Lives lost to opioid addiction. It is a nationwide epidemic, and as the opioid crisis rages on, pain specialists are looking to alternative ways to treat pain that do not rely on addictive prescription painkillers. In fact, a drug-free approach is offering many people an effective way to manage their chronic pain. Here to explain this strategy in fighting the opioid epidemic, Dr. Joshua Prager, the director of the Center for Rehabilitation of Pain Syndromes at UCLA Medical Plaza, along with his patient, Andrea Sherman. Dr. Prager, I want to get to that drug-free strategy that you're offering now. But first, tell us, what does it constitute in terms of meaning chronic pain versus regular pain?
Well, chronic pain is something that happens after you've had acute pain. Acute pain is the result of a fracture or some kind of injury or even surgery. And we expect that you'll have pain. Pain is a protective mechanism for that. Now, when it persists for more than 3 months, we call it chronic pain, which is essentially like a disease. It's an entity unto itself. It causes suffering, and it also has impact on the family and ability to work in the workplace.
What would be the impact on society for the burden of chronic pain?
Well, beyond the suffering and the potential for getting addicted to opioid medications, the economic impact is tremendous. A government study showed that $635 billion annually is the cost of chronic pain. Now, that's not only the cost of medical care, including emergency room visits, the expensive opioids that patients take, hospitalizations, but it's also the time in the workplace that's lost. And that, again, that's almost 2/3 of $1 trillion of lost money as a result of chronic pain.
All right, Andrea, we want to make sure we get to you. How did the chronic pain affect your life, and what about dealing with the pain?
Well, I was injured on the job when I was in my 20s. I lost the use of my right hand, and I was in excruciating pain from the moment it happened. I couldn't work, I couldn't function, I was completely disabled. I took opioids, and it really affected everything in my life. It broke up my marriage. It was really horrible. I tried everything. So I went years and couldn't figure out anything. And finally a doctor referred me to Dr. Prager, who recommended a spinal cord stimulator. And within 24 hours, I called him and said, this is the first decent night's sleep I've had in years. When can I have this miracle permanently?
Wow.
And since then, and it's almost been 20 years, I raised 2 kids on my own. I have my own business, I travel, I'm really active, and it really changed my life. It saved my life.
Well, we're so happy for you that you've been able to have that relief. Doctor, if you can, just quickly tell us, what is this non-addictive approach?
Well, we substitute electricity for medications. We send minute signals to the nervous system that block out the pain signals from getting to the brain. So not only does the patient not feel the pain, but they no longer suffer. We can do a trial which is minimally invasive, no cutting, so the patient gets a chance to know what it is. Now, if you want to find out more about this, because we're only talking a brief time this morning, go to a website. The Neuromodulation Society has provided a website called askaboutpain.com, and at that website, not only can you find out more about this technology, but you can find a board-certified, qualified, experienced clinician who can then provide this therapy to the patient. Once again, that website's called askaboutpain.com.
All right, Dr. Joshua Prager and patient Andrea Sherman, thank you so much for being with us. We appreciate it. Have a great day.